Welcome back to movementprofessional.com. This video is a standing back bend as well as a prone press up. So in a standing back bend, this is a good exercise to do after getting out of a chair. You want to have your feet facing forward, put your hands anywhere in the area of the lower back. Often you want to put them sort of in the area where you may have symptoms. You're trying to create a hinge point and also a stability point with your hands. Alright, so your hands are kind of creating a little bit of a pressure from back to front, and then you're just trying to bend back as much as you can. So in this case, you actually, for the most part, don't want to stabilize anything. You want to let your belly be soft and try to get as much range of motion out of it as possible, as long as there's not pain with that. Key factor here is keep the eyes facing forward, not looking up. Very often you look up and you're moving from the neck and not from the lower back. Alright, so you can repeat that 5 to 10 times depending on tolerance every time you get up from a chair. Alright, and then I move my hands up a little bit more there. You can bias a little bit up to the thoracic. So here we have a prone press up. If you have the means to get on the ground, now you're going to unload the spine a little bit and you'll be able to get possibly a little bit more range of motion into lumbar extension here. I look up, I'm used to doing that from yoga, but you can keep your eyes wherever you're comfortable. The motion is coming from the lower back. You want to think about, it's always important to organize the shoulders so the elbows are facing back or biceps facing forward. Okay, biceps facing forward. And you want to make sure that you're stabilizing the shoulder there so your shoulders aren't coming forward. Alright, you can either tighten the butt and kind of tuck the tailbone under if you want to isolate a little bit higher in the thoracic spine. If you just want to get a hinge from the lower part of the thoracic spine, actually let your buttocks be relaxed and don't have retention. It's really based on symptoms and if there's any type of discomfort. So if this feels fine, do a few, and what it does is it opens up the front of the hips as well as extending the lumbar spine, and then you can follow that up with a child's pose type movement. So you get your press up, and then you can follow it with a child's pose.